Welcome to Health Matters with Dr. Nelson Bulmash, sponsored by the UI Radio Network at uiradionetwork.org. Catch us on Facebook and Instagram at United Intentions and Twitter at Higher Intention. Look for us on 99.1 FM, iTunes, iHeartRadio, Spreaker, Stitcher, Blog Talk Radio, and many more. Over the next hour, we'll introduce you to some fascinating people and engaging discussions that may provide you with answers to assist in revolutionizing your own personal health. And now, here's Dr. Nelson.
I'm Dr. Nelson Bulmash. You're now listening to Health Matters on the United Intentions Radio Network. If you happen to be catching the show here in Atlanta on WDJY FM 99.1, in Florida on WWNN 93.5, and now in Kentucky on WMTA 107.3, welcome. It's a pleasure to have you listening along with us. And for the rest of you who are catching us on the World Wide Web, on all the major social media platforms, it is wonderful to have you as well. For those of you who are unfamiliar and joining us for the first time, I am Dr. Nelson Bulmash. I'm a chiropractor, naturopath, and nutritionist, among other things. And I am here to help you explore the worlds of health, inspiration, and spirituality. If you have seen this before, you know that I bring amazing guests, and today is no exception. For those of you that may have questions, you may reach out to us on Facebook Live. And for those of you who would like to call in, please do so. We're at 678-495-4345. Before we get started, and I'm very excited because the gentleman I'm interviewing is near and dear to me. He is an expert in pain management, and I have suffered with pain for many, many years, so I'm really excited to do this interview. But before I get started, I've got some things I have to mention to you. Okay? So you've heard me talk about this many, many times. This is an amazing series that we put out here. It's called Get Your Life Back Now. So if you haven't purchased this, don't do it yet. You can't miss the show, but after the show, you can find this by going to www.getyyourlifebacknow.live and take advantage of getting this DVD collection that can help you save your life. It's news you can actually use. And listen, we really want to connect with all of you, so please do so. To do so, you may find us. You can follow us on all the major social media platforms. We're on Facebook, Instagram, and YouTube as United Intentions and Higher Intention on Twitter. Now, here's a big surprise for you. Don't forget, if you didn't know, or if it's the first time you're hearing this, check it out. Tune in tomorrow on Tim Ray's Good Intentions show as he interviews transformational Grandmaster Bob Coates. That's this Thursday, November 15th at 11 a.m. Eastern Standard Time. Okay, let's jump in here. I have a lot I want to cover with you. So what I want to do first is I want to go over the background, because it is pretty amazing, of my friend Dr. Hal Blattman. And give me one sec. Here we go. Grab the right sheet here now. He's a pretty big, extensive background. Dr. Hal Blattman, M.D., is the founder and medical director of the Blattman Health and Wellness Center in Cincinnati, Ohio, a nationally recognized specialist in myofascial pain and co-author of The Art of Body Maintenance, Winner's Guide to Pain Relief, a reference for treating myofascial pain, from migraine headaches to plantar fasciitis. He is credentialed in pain management, occupational and environmental medicine, and integrative holistic medicine, and also trained in craniosacral therapy and healing touch. After receiving his medical degree from the Medical College of Pennsylvania in 1980, Dr. Blattman completed 2 years of training in orthopedic surgery. He later studied ergonomics and toxicology during his residency in occupational and environmental medicine at the University of Cincinnati Hospital. In the early 1990s, he studied with the late Dr. Janet Travell, a pain physician to President Kennedy. Dr. Blattman currently leads a team that specializes in the holistic and comprehensive rehabilitation and treatment of pain, ligament and tendon injury, fibromyalgia, and chronic fatigue syndrome. He is a past president of the American Holistic Medical Association with satellite offices, in Manhattan and Seattle. Dr. Hal Blattman, what a pleasure to have you, sir, on my show today.
Nelson, thank you. Thank you so very much. What a pleasure.
You are very, very welcome. I want to start this I'll do everything I can now to embarrass myself. Hal, when I was a young man, I was that guy that went in for injuries to the local hospitals so often that the nurses and doctors knew me by name. I remember one day going in for a bad. Had been in martial arts for many years, and I was trying to break a very, very heavy board across the grain, which is foolish, but we won't yet go there. And I remember the doctors and nurses say, "Oh, Nelson's back visiting us." So I won't say necessarily that I knew all the names of their children and their pets, but let's just say we were on a first-name basis.
Yes,
so
they knew who you were.
They knew who I was. And my poor mother and father, Hal, used to just shake their head like, why? Why? Anyhow,
yep.
What's interesting is, and I want to get our interview started this way, what happened is I would go in, and of course they would give me the state-of-the-art care of the day. If I had, let's say I really injured my ankle, sparring or jumping off of a high tree limb or something like that, they would x-ray it to make sure that it wasn't broken and I didn't need surgery or a cast. But when they found out that I didn't necessarily, it was kind of like, where do we go? Well, I got anti-inflammatory medication, I got pain medication, and often I got antispasmodics, and they said, hey, you're going to have to do this for several weeks. Come back, we'll check in 6 or 8 weeks. Well, eventually I, quote-unquote, healed. However, Hal, I never felt like I really healed. And here I am today in my mid-50s, and I wake up every day, and my wife has a cute little game that she plays, and it goes something like this. Hi, Dr. Blowmash. How are you, sweetheart? How are you feeling? 80, 85, 90, 92 today? And of
Where
course,
do you hurt today? That's right.
Yeah, that's exactly right. So my point is, Hal, that I asked myself this question: did these injuries really heal? And having seen you work and having known you for many years, and of course, I have to congratulate you. You have an amazing article, which I have here, that was just posted in the Townsend Letter this November. Congratulations on that.
Thank you very much.
You're so very welcome. It definitely occurs to me that you think with a different paradigm. Tell us why that is.
I was in orthopedic surgery. I was seeing all these things around me, and I was realizing that what we're doing isn't working for a lot of pain. It's one thing to make a broken bone straight again, but it's another thing to get people out of pain. And in those days, we started with 400 milligram ibuprofen. It was a brand new drug. And then when that didn't work, lo and behold, we had a 600 milligram size, and then came the 800 milligram size, and it still didn't make enough of a difference. And the stuff that I heard didn't make a whole lot of sense. And then it was a few years later, and I actually injured my lower back on the Nautilus low back machine. My wife's playing racquetball. I think I should go work out, and look what happens. And it's 4 or 5 days later, I still had not had my first pain-free moment, and my back was just killing me.
Right.
I'd never had an injury like that before. And I'm reading an orthopedic journal talking about how, as a physician, you can tell when this patient complaining of low back pain is faking. Because, that's a big deal, especially in days when pain medication was more freely given out.
Right.
And I realized that I couldn't pass the test. This guy would have thought I was faking.
Wow.
And I was really in a lot of pain. And I realized two things. One is the guy who wrote the article had never injured his lower back and never experienced low back pain before, most likely. And number two, even if he did, he had no idea what he was talking about.
Wow.
So I started to think, well, if that's our standard, this can't be right. And if you really think about it, what we do for pain, do you think it even works 10% of the time? Take migraine headache, for example. You have a migraine headache, you take your migraine drug, you get better for a couple of days, it comes back. It doesn't make them go away.
Right.
So if that happened to your tonsillitis, and every time you took your kid to the doctor and you got penicillin and then the tonsillitis came right back, you'd start to think penicillin didn't work.
That's right.
So our treatment for migraine doesn't work. And our treatment for low back pain, that doesn't seem to work a lot either. So I started to think there must be a different paradigm, because our biology has to heal. And we're not able to find the injuries, and we're not able to heal them. And we're making assumptions that are true enough of the time we keep doing it, but we're missing the boat. Like with your injuries, if you go home and what does your body do, for example, to that ankle sprain? Does it warm it up? Does it cool it down?
You mean
you sprain your ankle?
Yeah. Well, in the beginning, it got very hot.
Exactly. Why does your body warm that up?
So that it can increase the circulation dynamics and get things
Correct.
like...
And speed up metabolism
Right.
and speed up healing.
Yes.
And what happens in that chemical reaction in the first 48 hours sets the tone for how well you're going to heal. And anything you do to decrease and change that changes your outcome.
Interesting.
So if you put ice on that wound, you're not going to heal as well. If you take a nonsteroidal anti-inflammatory drug, the data shows that you'll have less pain, you'll have less swelling, you'll get back to work faster, and your ankle will still be unstable because it didn't heal well, and it will still bother you in 6 months.
Wow. And that's a very, very common finding.
It's a different way to think about it.
Yeah.
What does your body do? Let's augment and help the body do it better rather than sugarcoating it and interfering with the body does.
Interesting.
The body's figured out how to heal myself.
Right.
Right? Out of all these years and all the injuries we've had, people who didn't heal well didn't do well in the long run and maybe got out of the June pool.
Yeah, interesting way of saying it. Hal, listen, I have an interesting question for you. It sounds to me like your care of people to help reduce, eliminate, and manage these cases where people have had serious injuries, who are in intractable pain for long periods of time, is set based on very different principles. Is that the case?
Yes.
Tell me about those principles.
Yes, it is. So if we think about the way we think about pain around the world and what we teach doctors and our patients, we have an acute injury, goes to acute pain.
Right.
And then if that isn't gone in 3 to 6 months, it magically turns into chronic pain, and you can never make it go away. You have to kill the nerve, interrupt the signal, take a lot of drugs, make the brain not work. You know the drill.
The drill, yes.
There's another way to think, and that is acute injury, yes, goes to acute pain, yes. But then the difference is our biology will continue to experience some evolution of that pain and injury until we heal it and make it go away. And as soon as we can figure out where those injuries are that cause the pain and get the body to heal them, the pain will go away as fast as we do that. Doesn't matter whether it's 5 years, 20 years, or 30 years. And that paradigm is much closer to what our biologic reality really is.
Interesting. Tell me. I'm so sorry. Please continue.
When somebody comes in to see me, for example, after history taking and listening and hearing the story, the physical exam comes. And the physical exam is me and the patient examining the patient together at the same time. It's not something I do to you. It's something we do together.
Interesting. Okay.
And so I look at, we're playing CSI if we can, the Blattman rules of CSI for figuring out where does pain come from.
Please.
And so I've got that narrowed down to 5 rules.
And what are they?
Rule number 1, you as the patient can't believe that the pain really comes from where you feel it. Your headache doesn't come from your head, even though we were taught about that.
Right.
The pain in your left arm could be your heart attack. You have no idea. The pain in your knee might not even come from your joint. And the clearest example is the people we know who have had a total joint replacement of their knee, and the knee still hurts.
Yeah, that's fascinating.
And there's no knee there. So a lot of that pain doesn't come from the knee. So I started to think, all right, so let's look at something else. Rule number 2. It's not important what we think the pain feels like. Do you remember how much time we spend in patient interviews? Where is it burning? Where is it tingling? Where is it sharp? Where is it dull? Where is it achy?
Yes, I do. I sure do.
None of it matters.
Ah, interesting.
Our brain cannot tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy. And as soon as you tell the doctor it burns and it tingles and it radiates, we're already thinking nerve and disc, and sometimes nothing could be further from the truth.
Tell us more.
Rule number 3, the only thing you can believe when we examine your body together is that where specifically you are tender, millimeter by millimeter, is either where the strings of fascia that go through your body and hold it together are tied in a knot, or where they attach to you. And tendons don't attach to bone. The strings of the tendon interweave with the strings that cover the bone that we call periosteum, and you've injured that and pulled it loose. Or injured it and it's tender and needs to be repaired. And rule number 4, as we do that exam, the places that are specifically most tender, millimeter by millimeter, represent the more serious of the injuries that are causing the pain that you are most aware of.
Got it.
And rule number 5, as quickly as you can make the kinks in the fascia go away and heal those injuries where we've pulled on ourselves, you'll watch the pain you thought you had go away.
Wow, fantastic. Dr. Blattman, we've got to take a commercial break. Folks, this is Dr. Nelson Bulmash. You're listening to Health Matters, and my guest is the esteemed Dr. Hal Blattman. We'll be right back.
Are you ready to be the hero of your own story? It's time to put the power of your health back into your hands. Join us for our free 25-day journey to get your life back now from chronic illness. Our doctors and experts will guide you back to optimal health.
In my opinion, there is not a drug in the world for a chronic disease that I would consider. Not one. Acute, yes. You got appendicitis, of course. I prefer to take it out. You know, they're now treating appendicitis with 3 weeks of bed rest and antibiotics. I'd rather have it taken out. I think it's safer than taking antibiotics for 3 weeks. And surgery, fine, wonderful, go with it. But the incidence of suicide, once they put you on antidepressants, which do not work, there are 4 major articles saying if all the negative studies had been allowed by the pharmacomafia to be published, the net results would be 0.
Go to www.getyourlifebacknow.live and begin your journey today.
Hello again, everyone. I'm Dr. Nelson Bulmash. You've joined us for Health Matters, and my guest today is Dr. Hal Blattman. Hal, you were on point 5, your 5 principles of pain. Did you have anything else you wanted to say about that?
Just working through that and then helping people figure it out and then getting the body to heal. But, you know, you can feel this yourself on your own body if you're a listener right now.
Tell us how we can do that.
So most everybody can feel that there's a tight rope and a tender knot right in this muscle in the front of your neck.
Yeah.
Feel this one? You get a big bite and you can feel that. And as soon as you feel that knot in that rope, that's the tightest part's where the trigger point is, and the rope you feel is the ropey band that comes from the fascia or the muscle winding itself up into a knot. The injury you can also feel. Take your finger and touch your clavicle down here,
okay,
and the top of it, not the bottom, not the front, but the very top, and feel where it's tender down here toward the middle. Got a tender spot there?
Yeah, yes, I do.
Much more tender than you ever thought, right?
Alarmingly so.
That tender spot is the injury where your fascia attachment has been pulled on, and this knot is where it kind of went up and collected. So where did you get that injury? I'm going to suggest that many of us got that injury on the playground when we were children, and somebody came up behind us and pushed us forward and snapped our neck back and tore this string and twisted the muscle into this little knot that we get to wear for the rest of our lives until somebody teaches us how to make it go away. And the consequences of that are on this chart.
Can you show us that?
The X,
there we go.
The X's represent the location of the knot. The red speckles down here are the injury. And this red speckle, that's the pain pattern that our brain is going to interpret as numbness, tingling, burning, itch, tickle, sharp, dull, achy, and it's part of your migraine.
Right. Fascinating. And it is interesting that you said that we developed this often while we were playing on the playground and somebody pushed us hard and whipping our neck back, because I don't think I've ever met, Hal, a person that didn't have those trigger points.
Exactly. And there were a lot of us that got pushed or had other traumas that happened to. Here's another one. These muscles up here.
Right. How
many of us know how tight they are?
The traps.
And how tender they are?
Yes.
Exactly. Where did that come from? Well, same kind of thing. You're strong enough to contract this muscle,
right,
to lift and carry your book bag as a second grader,
yep,
and lift and carry your briefcase and your suitcase and whatever else you did. But where you hold together out here on the sides and where you hold together here in the middle isn't strong enough to hold you when you pull that hard. And that slips from both ends and twists into the knots and ropes that we have in our shoulder traps.
Interesting.
That's where those injuries come from also. Plus, maybe you played football and maybe you played soccer and maybe you did all those other things too.
Absolutely. So tell us, you have these findings. How do you treat that? What is your methodology for helping to unwind these knots? First of all, is it possible?
Yes, it's very possible. And everybody can do a lot of it themselves without even going to a doctor.
Tell us how.
Just the beautiful part. That place where the knot is, the reason we know about this is the nerve endings in between the strings of fascia that tell our brain two things: friction as the strings move and pressure. So anytime there's a shear force or a string pulls loose, you feel that wherever that string happens to go. And we're one string from head all the way to foot.
So it's continuous.
We just interweave and attach. Yes, we're continuous strings. So if you injure that string where it attaches on the side of your hip, that string goes from your lower back all the way down to your foot. You might feel that as a shot of pain that goes all the way down to your foot, and you think it's a nerve. But it's actually the nerve endings in between your strings telling your brain what's going on in the periphery. So this interaction of nervous system in between fascia, strings, and cords and fibrils is the antenna that tells our brain what is our periphery doing.
So this really helps to update some of the old school notions that, for example, you injure your back, you compress a disc, it inflames, it compresses a nerve. This really takes our understanding to a whole new level.
A whole different level. Well, that's true sometimes.
Sure.
And while what we were taught still happens, most of the injuries are not what we thought they were, and most of pain is not what we were taught.
Sure. So we've had an incomplete understanding of the mechanism that creates pain.
Exactly. And we've heavily weighted that incomplete understanding to diagnostic testing, MRI scans, CT scans, X-rays. And truth be told, for most people that are listening, if you've had pain for a long time, and maybe you've had surgery, and maybe you've had all kinds of other things done, the question I want to ask is, has the doctor who's ordered that ever really touched you?
Well, that's a tricky question because I can't tell you how many times I've been injured and I've seen a doctor and they simply ask questions. They never actually palpate the site of injury or the site of pain.
And your touch and examination is by MRI scan, CT scan, and X-ray.
Which is incomplete.
And there's nothing that I showed you in the Blattman rules of CSI for pain that didn't involve touch.
Interesting.
And we're not taught how to touch. And if we did touch, it's a little tight, it's a little spasm, we're not taught to understand what we really feel.
Yes, I could not agree more. Well, I'd love to go through some scenarios with you if you're open to that.
Sure.
Okay, so you've spoken a little bit about low back. Let's begin there. So, Hal, a patient comes in and they report intense, unrelenting low back pain. And Hal, in many cases, and this won't surprise you, but it may surprise many of the people listening, these people have not actually injured themselves. I mean, how many times have you had a patient come in and say, Doc, I don't know what happened. I woke up and I couldn't walk. I couldn't move. I had a gentleman in before the show, that very scenario. I don't know what happened, Nelson. I woke up and I can't walk.
You're going to be amazed by this answer, and you're going to just scratch your head on this. Every once in a while, it's really a disc.
Right.
You bend over, you pick something up, the disc shatters, it pushes on a nerve. My mother's one of those. And she got the disc taken out later on that week, and she was fine in her lower back for the rest of her life.
Sure.
But how many people do you know have that surgery and they're not so fine for the rest of their life?
And this gentleman, by the way, interestingly, I did the work that I do, and he walked out saying, thank God, Nelson, I can walk again. So the question I have for you, in his case, Hal, this was not caused by any kind of an injury per se. He literally got up and he said, I don't know what's going on. I can't walk. I can't even get up to go to the bathroom.
So most of the pain comes from the nerve endings in between the strings caught up in that knot.
Okay.
And that squishes on it hard enough that you get all kinds of sensations that go up and down the line of where the strings go.
Right.
And the injury probably happened a long time ago. The injuries that cause lower back pain are most often to our tendons that hold our butt muscles together. And we injured them when we were children, jumping out of trees, jumping out of the swing set, jumping down the steps.
Right.
And most of us, a lot of us, even remember how many steps we could jump down. And the only reason I didn't try the whole flight was because there was a wall in the way. And then you were either the child that led the other kids, followed the other kids, or watched the other kids jump off the roof. And every once in a while you'll hear, no, it wasn't the roof, it was the hayloft.
Right, yes.
And I thought it would be more cushioned than it was.
Yes.
Yeah.
Goodness, guilty on all accounts, Hal.
And so the injuries happen where those attachments are, and we have tender knots in the muscles of our butt. And if you examine a lot of people with lower back pain, their lower back is not nearly as tender as their butt muscles.
Agreed.
And that's a primary giveaway. Heal the butt muscle. So what a patient can do on their own, wherever these muscles are, traps, arms, neck, if you put pressure on that knot, you'll squish it. And it hurts to do that because the nerve ending's in between the strings and they're sensitive anyway.
Absolutely.
So when you push, you're allowed to push as hard as you want, as long as you can totally relax with the discomfort you cause. We call that a good hurt.
Right.
And the knot gets smaller, and when you release, all the tension on those nerve endings is less. And that decreases all the sensations of discomfort that come out of that, and it will last until this tightens back up again. And that's dependent upon how hard do you pull and also what do you eat.
Interesting.
And that's the great equalizer. And for that man who woke up with that pain, something made him tie himself together overnight. It isn't any different than a stiff neck.
Right.
And the stiff neck doesn't happen from the window. You don't sleep that wrong unless maybe you have Ehlers-Danlos. You just don't sleep wrong enough to get into pain. Most likely it's an inflammatory reaction in your fascia that comes from last night's food.
Very, very good point.
And that's the shock. So he probably had an unusual dose of something that inflamed his body within 6 to 12 hours of that exacerbation of pain that really set him off.
Love it. And Hal, a little later in the show, we're going to take a break in a few more minutes, but when we come back from that, I want to have a specific conversation with you about how food impacts our inflammatory processes and therefore our pain. But before we do, we have just enough time to get into one more body part. We talked a little bit about neck. Anything more you want to say about helping to eliminate or reduce issues involving the neck?
We teach in our book where these pain patterns are, like the one I showed you from this, and how to use a little rubber ball about this size. Because you can massage muscles that have strings that go up your neck that tighten this, and the core muscle for head and neck pain is the one over your shoulder blade, believe it or not, and it's not even close to your neck.
Right.
And that's right down here. So we teach in the book how to use the rubber ball to massage that. But let's talk about how to stretch, because this is fascinating.
Yes.
Every stretch you've ever been taught for your neck is pulling on the ends of your strings. For example, this motion pulls on the ends, right?
Right.
This motion pulls on the ends. The pain comes from the knot in the middle of the shoelace, and we've been teaching people to pull on the ends. So if you want to stretch your neck without pulling on the ends, without irritating the muscle, you get your fingers on this rope, and you very, very slowly try to unkink the strings using the skin as a handle all the way up to where it touches and attaches to bone, and then a little further.
Interesting.
That will stretch muscle.
Right.
Way better than pulling on the ends. You can adapt that to hamstrings. You can adapt that to your thigh. You can use that to any muscle you can reach and touch, or what muscles other people can reach and touch on your body when you can't reach and touch them yourself. And for everything else, this little rubber ball, because you don't need anybody else to use this, and you can use it all over your body on the parts that you can't reach. And with just what you can do yourself, massaging these knots away, changing the tension in the strings of fascia that hold you together,
right,
and decreasing the inflammation in your fascia that comes from your food, you may be able to make 40% of your pain go away just from that, like it was never even there.
I love it.
Right.
Hal, we're going to take a break. Folks, we'll be right back. We've got Dr. Hal Blattman here. We're talking about how to reduce, eliminate, and manage various types of pain problems. You're listening to Health Matters. I'm Dr. Nelson Bulmesh. We'll be right back.
Autumn in New York, why does it seem so inviting?
Craving more? Well, check out our bonus videos on Patreon at patreon.com/UI Radio Network. For only $2 a month, which you can cancel at any time, you can watch all of our exciting, inspiring, and sometimes controversial videos. So what are you waiting for? Head on over to patreon.com/UI Radio Network.
Autumn in New York.
Hello, everyone. I'm Dr. Nelson Bulmesh. You're listening to Health Matters. I'm talking to my esteemed guest, Dr. Hal Blattman, and we're talking about how to reduce, eliminate, and manage your pain problems. Hal, thank you. Let's get back. I have so much I want to cover with you. I want to talk about a few more pain problems, and I told you I have a curveball that I'm going to throw at you here. You ready for it?
Sure am.
Thank you, Hal. So what do you do, Hal, if you have somebody that has done something to a knee 20, 30, maybe even 40 years ago? They never really took care of it properly. You take an x-ray, Hal. They have very, very severe osteoarthritic changes. Can a person like this be helped with your system of care?
One of the things I like to know is how much motion is still retained. For example, if someone can only bend their knee a little bit, I don't know that the work I do is going to get you more comfortable.
Okay.
On the other hand, if you can totally straighten your knee and you can bend it at least 90 degrees, I can tell you with pretty much absolute certainty that you can't possibly be bone on bone through this range of motion.
Sure.
Or you would not be able to move.
Got it.
So if you can still do that, then you probably have enough cartilage to regenerate. And here's an interesting question. The orthopedic textbooks tell us that we're born with a certain amount of cartilage, we wear it out with time, and then we got nothing left and we have to get a new joint. Does that make any sense?
It doesn't to me.
We grow a new intestinal lining every 3 days at 27 maybe billion cells. We grow new skin every 7 to 10 days.
Right.
We grow new brain cells. It doesn't make any sense to me that we don't grow cartilage to repair from daily wear and tear.
Agree. Very good point.
Okay. So, number one, think that a lot of the pain may not be coming from the knee, may be coming from how the fascia attaches, holds the knee, and gets it to move, which is what we mentioned in the very first part of the talk. But let's say we want to regenerate cartilage, because a lot of times that's in the deal. Your cartilage is worn very thin and you need to grow it back.
Sure.
So we've just mentioned the idea that you're probably not bone on bone if you can still move. So how do you regenerate? Two things need to happen. Overall, you need to balance the equation between wear and tear and your body's ability to rebuild. If you can't equal wear and tear and rebuild and balance that out, then you continue to wear and tear with time. And whatever we do, we have the concept of how long will it last and when will it wear out.
Got it. So in other words...
On the other hand, if we can balance, then whatever we do is sustainable for your lifetime.
I love it. So in other words, if you're, and you and I both heard a lot of, for example, long-distance runners say, I don't want to give up my long-distance running. Well, what we know now that we didn't know maybe 20 or 30 years ago, Hal, is that running long distances on really hard surfaces like concrete can place a lot of severe wear and tear on joints, particularly our knees and our feet. And It's interesting because about 20 years after I did a lot of really heavy running, that involved me running 10, 20 plus miles in a day, I started having this severe knee pain bilaterally, joint margins, and had no explanation, nor did anybody else. And then I put two and two together and I thought, you know what? Once again, my past is catching up with me. So, Hal, listen, I have a question for you. What I'm hearing here is that we do not continue to do the things that created a lot of the destruction in the first place, number one. You agree?
We have to modify ourselves.
Yes.
I walked off the tennis court 20 years ago. I'm playing with my son. We're on the same doubles team together. He's the ringer, obviously.
Right.
A ball comes 2 steps away and I miss it. I didn't even go for it. And he says, "Dad, that was only 2 steps away. You could have gotten that." And I said, my knees hurt so bad. I've got 1 step, or it comes right to me, or it's yours.
Yours. I love
Glad you've got wheels.
Yes. Excellent.
And I didn't get back on the tennis court for 2 months.
Wow.
And at that same time, I learned about glucosamine hydrochloride. Everybody talks about glucosamine sulfate and chondroitin. All I had was glucosamine hydrochloride. A month later, I'm scratching my head whether I'm any better. 2 months later, I was back on the court. 6 months later, I was pain-free.
Wow. So is this an oral or is this a transdermal?
That was oral.
Okay.
And then I ran out of glucosamine a year later. A month later, the pain starts to come back. And I'm still playing tennis. I find glucosamine sulfate. I start to take that. A few days later, the pain is gone again because I'm right there on that teeter-totter of
Edge,
balance.
right? Got it.
Right. So what I've learned how to do with my knees is how do you wear them out slower and how do you restore and regrow cartilage faster than your body can do on its own. If you can do that, you can balance the equation of wear and tear and rebuild. So to decrease wear and tear, a few things are really important. 1, take the escalator, take the elevator, don't be walking steps when you don't have to, and never put your knees on the ground and kneel unless there's a big pillow or serious knee pads underneath them.
Yeah.
Knees aren't meant to be kneeled on.
Yeah, all you have
then
to
on
do.
The other, so those things decrease wear and tear.
Right.
So then to add to rebuilding, the most important thing to make work is glucosamine. And a glucosamine by mouth, glucosamine sulfate works really well. The chondroitin does not seem to be important. You can buy a less costly product. But if you read a study that says glucosamine doesn't work for knees, they used a glucosamine in the study that didn't work. Don't interpret that to mean glucosamine doesn't work. Change your brand if glucosamine's not working for your knees.
And you indicated
it's not 100%, but it's pretty strong.
And you indicated you could use glucosamine sulfate and hydrochloride.
Correct.
Yes.
And we actually use the hydrochloride in the cream because it does better. So the capsules and pills work for knees, but they don't work for your jaw. They don't work for your thumb. They don't work for your knuckles. They don't work for your ankle. You have to put the glucosamine in through your skin. We call that transdermally. So we use glucosamine cream that we have perfected something with our compounding pharmacist, and we use that for everything from the big toe to the jaw joint to the back of the neck. Beyond that, we can actually inject glucosamine into joints.
Right.
And we find that works really well, is fairly inexpensive. And if we need more horsepower, we inject platelet-rich plasma, a blood product from your own body that's taken out of your blood, or stem cells that are much more potent if we get them from placenta products and cord blood products from healthy live birth babies. And with all those tools, we have a pretty good chance to regenerate joint cartilage in most places in your body.
That sounds incredible, Hal. So I want to ask you a few more questions, one of which is it's remarkable to me that you have found a glucosamine product that gets into the body from a transdermal perspective because it's a pretty large molecule. So what amazing technology has been developed to allow you to get that through the skin into the tissues underlying the skin. And
those are secrets from the compounding pharmacist, but it's not a new technology so much. We put hormones through the skin in a patch.
Sure.
We put anti-inflammatory drugs through the skin in creams. Why wouldn't we think glucosamine would go in?
I think, Hal, it's an amazing idea. I just wasn't aware that you'd had that much success with that. That's fantastic.
And I have a buddy in tennis, and he's complaining about his wrist hurting. And I try the glucosamine cream, and you rub it on your wrist 3 or 4 times a day. He's back on the court in 3 weeks, and his wrist doesn't hurt anymore. And he runs out of the cream and calls me for a refill a month later when his wrist starts to hurt again.
Wow.
Because you're still traumatizing, and all you need to do is accelerate your body's ability to rebuild and restore.
Sure. I'd ask you, Hal, if you could send me some to rebuild my shoulders so I could once and for all get that 600-pound bench under my belt, but I think my wife would kill me before I got home.
You know, we're old enough as we get older that if we push too much weight, we can actually tear our tendons away from the fascia and bone, and you could end up wearing your pecs on your sternum. I have a friend who tried pole vaulting at 50 years old. He had the same problem.
Oh.
And yeah, it was miserable, and they can't restore that for you.
No.
So
I think I think you've just changed my mind, Hal. That's not pretty. That's not a pretty visual.
Keep muscle tone, but forget all about, you know, the testosterone that allows you to bench 500 pounds.
Fair enough, Hal. Fair enough. So let's talk about, in other words, you have had some success, obviously, with using PRP therapy, the plasma-rich, with rebuilding the cartilage matrix of the knees, is what I'm hearing here.
For all kinds of things. It's an amazing set of growth factors that comes right from your body. And your body knows what to do with them.
Right.
Rotator cuff tears and other tendon injuries are a prime example. You've heard of partial rotator cuff tears.
Of course. Deal with it every day.
It's not so much a partial tear as an incomplete heel.
Ah, okay.
We have tears all the time. But why it still hurts is because when your body healed it, it only did the healing it could do. Maybe you decreased the healing response with ice and ibuprofen. Maybe.
Definitely.
Or maybe it was just too big a tear for your body to handle. But 6 weeks later, give or take, there's a little healing that goes on even for months, but most of it's done in 6 months. And how do you know? You skin your knee, you bleed, you make a scab, the scab falls off in 4 weeks.
Right.
The skin underneath is a pinkish color, and a couple weeks later it turns normal. That's the time of most of our healing. So when this shoulder still hurts 3 months later, your body has no idea it did an incomplete job. Your body thinks it's done.
It's done, right.
So you have an incomplete heal on whatever injury you had with multiple injuries through your lifetime.
So,
right? Because you didn't just do it once.
So this is why, for example, needling an injury like what you just described can be effective, because it must re-engage the body's awareness that damage has been done, but not damage that's so severe that it can't readily heal.
Right. So you have to tell the body there's a new injury so the body knows to send stuff to heal it. So you can do that with an acupuncture needle. Just poke some holes. But the healing from just that would be really, really small.
Right.
You can put Novocaine and dextrose in your needle. That's a traditional solution that we would call prolotherapy. And that makes the cells nearby the injection shrink. It makes the body think the injury is more severe than just a needle poke, and so it sends bigger healing. We call that prolotherapy.
And that I know is very effective. I had it done many times.
If we take blood out of you and concentrate the parts that would make that scab and put that in the syringe and put that in when we poke the little holes, in 4 weeks when the scab falls out of your tendon, you have new parts holding you together, just like growing skin on your knee.
That's incredible.
You don't know that you'll be one and done, but it's rare in our experience you're not one and better.
So that would obviously be very good for young people who are athletes who want to return to the arena, but it sounds like it'd be pretty fantastic for an older gentleman like myself who's had 1,000 assorted injuries that leave me walking like I'm 92 first thing in the morning.
I have an 80-year-old man who had a rotator cuff injury to the back of his shoulder, and all he wanted to do was play golf. It took 3 PRP treatments to heal his tendon enough that he could play golf. So at 80 years old, one and done might be a little harder. The tendon's a little older, all those things.
Right.
But it still helped. And you know what? If you want to argue that it won't help you, then you should expect that skinning your knee won't grow a scab and you'll bleed to death.
It makes sense, Hal. It's all very, very logical. I love it. Hal, listen,
if we want to ramp it up, we'll come back, talk about stem cells.
You took the words out of my mouth, my friend. We're on the same page. Folks, listen, I'm Dr. Nelson Bulmesh. You're listening to Health Matters. My guest is Dr. Hal Blattman. We're going to be talking about stem cells and how they can help you heal from injuries that you have failed to heal from in the past. Don't touch that dial. We'll be right back.
there, I'm Dr. Amy Dayries, a general and integrative dentist in Roswell, Georgia, and I'm also a spokesperson for the American Dental Association. You know, as a dentist, I tell my patients that the mouth is the window to one's overall health, just as the eyes are the window to one's soul. After working in general dentistry for the last 25 years, it has become my desire to offer good health resource information to everyone around me, empowering members of the public to become their best, healthiest selves. The Whole Healing Radio Show features practitioners from dentistry, healthcare, and nutrition about the cutting-edge techniques available. Together, my guests and I will show you how to implement lifestyle changes, achieve your personal goals for health, and heal the parts of you that may have been forgotten. When your health is intact, you can go on to manifest your ultimate dreams. Become the best version of yourself. Join me, Dr. Amy Dayries, on the Whole Healing Radio Show to learn how.
Hello, folks. Dr. Nelson Blumash. We're returning. You're listening to Health Matters, and my guest is Dr. Hal Blattman. Hal, we're talking about innovative ways to help injuries heal. Let's talk stem cells.
So I was saying we can get stem cells from three places legally. One is we can get them from liposuction, a mini liposuction of abdominal fat.
Right.
We can put a small hole in your pelvic bone and take out bone marrow, or we can order them up from live, healthy birth babies. And the most potent stem cell products that we can use today come from live birth babies that are, the babies are born by C-section. The mother agrees to donate the placenta products. They're then tested, and if it passes all those tests, then we can use that. They can cryopreserve it and send it to us to be able to use in the field, so to speak.
Right.
Fantastic. So we don't have to traumatize your body. We're allowed to use them intravenously, and we're allowed to use them directly into tendon, directly into muscle, directly into joint. And we see remarkable healing in men among many, many things. Growing cartilage in joints is a great thing. Being able to be closer to one and done with a tendon injury in an NFL or a sports player,
right,
or a weekend warrior or an older person that just wants to be better. Being able to use them intravenously for things that we could never have hoped for before. There is success with people being improved with Parkinson's and rheumatoid arthritis and MS. All kinds of things have been helpful. I have a young woman, she's in her early 30s, with severe rheumatoid arthritis. Her finger joints go sideways.
Yes.
Her elbow is mostly destroyed. She has to move her arm with her other hand.
Poor thing.
And she has been with me 3 weeks of week-long intensive therapy sessions over the past year. And she came in just this past week, and she was able to just take her coat off by dropping it.
That's remarkable.
The swelling in her finger joints is decreased enough she can put gloves back on her hands.
Wow.
We're watching her body restore. And the people that help her and are with her think, and I would agree, it costs less to spend the resources to help her body heal and recover than to pay for her care as an invalid for the next 40 years of her life and all the medications that would.
I get that, Hal. Goodness.
And she's able to work. She was able to last 8 hours in a job one day where she hasn't lasted more than 4 hours in a long time. And she said when she packed to come here, because she comes from an 8-hour drive away if she doesn't have to stop.
Right.
She said when she was packing, she was actually moving fast enough she could work up a sweat instead of writhing and crying in pain with every move.
That's incredible.
Those are stories that are amazing.
That's amazing. So Hal, I have to hear this again because it's so astounding to me. Are you saying that the joints of her hand are being recrafted, if you will, with the stem cells?
Yeah. Yes.
That's
her body is shutting down the immune response that made it go goofy.
Yeah.
And it's helping her body repair the tissue that got destroyed. It's the only way to interpret this of improvement.
That's right. That's incredible. Right. So, wow. Once again, this is a whole other show. I'd love to speak to you even more about that.
What's also nice is you no longer have to go overseas to get this kind of treatment.
Right.
It's available right here, right now, legally in the United States of America. You don't have to go to Germany for $30,000. You can do it right here, and we are able to do it in Cincinnati, in our main office. We're able to do it in Manhattan, and we're able to do it also when we travel and go to Seattle.
I am so impressed and inspired. I mean, you and I both have had many people over the years that have very, very severe diseases like rheumatoid arthritis. And, for a lot of people in terms of quality of life, it's almost a death sentence.
There's potential to help a lung heal from COPD and emphysema,
right?
To help a heart heal from heart failure. So for us in integrative medicine to put all these pieces together with diet and nutrition and health and healing and take the things that are not helping you, like ibuprofen, for example. We're not taught what these drugs do that's bad, and some of them are in our way. We're not taught that it causes kidney failure. We're not taught that it causes ulcer disease, although we hear that one more often.
Right.
We're not taught that it stops our body from being able to repair cartilage. It inhibits glycosaminoglycan synthesis. The main drugs that we're taking for our joint pain get us ready for joint replacement faster.
You're right. Very good point, Hal.
And recent information, it also causes heart attacks.
Yeah.
So why would you want to take that?
Yeah, very, very, very good point. Hal, I hate to cut off this topic specifically, but we've got to move on to some other things before we run out of time, which we are going to soon anyhow. I'm going to have to steal you away again and have you on for a second show.
Would be an awesome pleasure.
Thank you so much, Hal. I want to talk about something that it's hard to believe, but food, Hal, the impact of food is still so undervalued by so many people. When I bring up this conversation, I'm a naturopath, I'm a nutritionist, and I have people look at me sideways when I say, look, you cannot eat this refined food. You must give up wheat. You must give up dairy. You must give up the corn and the soy and so forth. What are your feelings about how food specifically impacts the inflammatory process, the healing process, and reducing people's pain and helping to inspire them in their avoidance of these kinds of foods to heal properly?
Pain does not fall down from the sky. If you wake up with pain you didn't have last night when you went to bed, and you didn't fall out of a tree, sleepwalk, and get injured overnight, you ate something last night and your body is smacking you upside the head or kicking you in the tail. If you go to bed in pain you didn't have this morning, most likely it came from breakfast or lunch.
That is such a good point.
And if your Percocet doesn't work as well today as it did 5 years ago, it's not because Percocet is less effective. It's because you're more injured, you're more inflamed, and you're eating food that pushes the Percocet off the receptors in your brain so it can't work as well.
Interesting. So if we begin to eliminate some of the foods that I talked about that are so pro-inflammatory, we unlock these receptor sites, should we need them, and at least while we're going through some of the non-conventional innovative strategies that you and I have been talking about, then you get better binding of the medication so that you get less in pain and inflammation.
And 4 weeks after your food is fixed, your Percocet works a whole lot better than it used to.
Isn't that incredible?
And one of the issues is that we're taught as a society to believe in partial credit.
Yes.
Right?
Yes.
We get some of the answer right. We don't get the whole answer wrong.
Right.
All right. So we think that partial credit also counts if I'm a little gluten-free.
Yeah.
Or if I'm a little dairy-free.
Oh, pet peeve.
But the issue is partial credit's like hammers. It's going to hurt a whole lot worse getting hit hard with a big hammer than hitting soft with a little hammer.
Right.
It's going to hurt more if you're chased by 20 bees than if you're chased by one.
Agreed.
But this isn't about hammers. This is about your immune system. And if your immune system is sensitive to bees, how many does it take to kill you?
One.
So you don't even get cross-contamination on bread flour if you really want to not hurt. You can't put your gluten-free bread in the toaster rack that toasted white bread or wheat bread or anything with gluten until that rack is washed off.
Yeah, yeah.
You don't get partial credit. And while people do feel better when they stop drinking soda and they stop eating the bread, and they do get better, if you want to feel really good, our body's job is to make us feel good 24 hours a day. If we're not feeling good, our body is telling us that it doesn't like something we're doing. It's our job to figure it out.
Hal, I think it was Fasano from Harvard who said about 2 or 3 years ago that There is no such thing as partial credit, if you will, with regard to eating something like wheat, that even if you're not suffering from celiac disease, he indicated that one exposure to wheat can create an immune response that in some people lasts for 3 to 6 months.
Exactly right. Exactly my point. You don't get away with it. You know, people think that anything is good in moderation. You've heard that.
I have many times.
I suggest to those people that the next time they have a dinner party and friends over, they lay out one line of PCP for every one of their guests. Because 2 lines is not moderation, and 1 line might be.
Might be.
And everybody looks at you like, that's nuts, but they get it.
Yeah, yeah. Hey,
You
now
don't get
listen,
away with that.
We've got somebody who wants to ask you a question here. Somebody online. Okay.
Bullmash.
Hello.
Good evening, guys. Hi, this is Dr. Andrew Black giving you guys a call. I want to talk about regeneration of torn muscle fibers through whatever methods you know.
Oh, go ahead.
Prolozone, things of that nature. Just to the regenerative medicine.
Go ahead.
If you can feel the knot that's bunched up and you can feel the defect, you need to unkink the strings in the knot. You need to get that rope to open up, and then you need to get the fibers to grow back together. And yes, if the defect isn't too big, you can certainly make that happen. How much you can make that happen depends on how well your body heals. Is your nutrition right? And do all those other things, as optimal as they can be, give you a better chance?
Now,
right. What nutrition do you recommend for regrowth of muscle fibers specifically?
We use some protein powders. We take the inflammatory food out of the diet, and we use our hands.
Right, absolutely. Yeah, I'm a body worker. That's what I do. So that's why Dr. Bullmash asked me to call in. What is your opinion on prolo and neurotherapy, prolozone, those type of adjunct therapies for regeneration stem cells also?
We do all that. We do every bit of that in our office. We've done prolozone for several years. We've done prolotherapy for probably 25 years. We've been doing trigger point injections for probably 30 years.
Nice.
We've done this
and you use that in
for a
combination
very long time.
you use that in combination with manual therapies, body work, adjusting, that kind of thing?
Absolutely. The trigger point injection unlocks the knot. The trigger point injection, the way we do it, will actually open and spread apart the fibers in that ropey band that are stuck together.
Sure.
But what unkinks the strings, the needle doesn't unkink the strings. The hands get the strings to unkink.
Exactly.
Gentlemen, I hate to interrupt you, but we are out of time. Thank you so much, Andrew, for calling in.
Thanks for the call.
It's great to have you call in. Appreciate it very much. Dr. Hal Blattman, it's been a pleasure, sir, to have you on the show. Folks, we'll be back.
Totally a pleasure here, too. Thank you so much.
You're so very welcome. Dr. Blattman, I'd love for you to hang in there. I want to talk to you for a few minutes afterwards. Got to close down, folks. I will be back after Thanksgiving. I will be interviewing the amazing Hope Merrill from the Conscious Living Journal. I'll see you then.
Thank you for joining us on this edition of Health Matters with Dr. Nelson Bullmash, where we help you discover how to ignite your mind, body, and spirit connection. Join us next time when we will bring you more exciting guests and engaging topics. Meanwhile, feed your mind, exercise your body, and nurture your spirit. The United Intentions Foundation and its associates take no responsibility for the opinions and statements made by the talk show hosts or their guests.